Hello, my name is Brittany Riley, and today I'm going to be doing the subcutaneous injection skills video for Nightingale College. I have gathered all my supplies here. I have my patient, I have my medication, I have my 25 gauge 5/8 of an inch needle. That is a 1 milliliter syringe. The medication today is going to be heparin. I have my gloves, hand sanitizer for hand hygiene, my sharps container, alcohol swabs and gauze, and of course my trash can. The first thing that I'm going to do is I'm going to go over the physician's orders. I'm going to go over the 6 rights of medication, which is the right patient, right medication, right dose, right time, right route, and then right documentation. And I'm going to look that over and verify with the MAR, which I have done, and I have gathered all my supplies, and I can go ahead and go into my patient's room. So I'm going to knock on the door, and my patient has invited me in. I'm going to provide privacy by closing the door or the curtain for my patient, and I'm going to introduce myself. Hello, my name is Brittany, and I'm going to be your nurse today. How are you? Great, I'm glad to hear that. Well, today I am going to be administering your heparin dose. Before I get started, can I please have you state your name, full name, and date of birth? And my patient is verified by the wristband. I'm going to ask my patient, do you have any known allergies to any food, medication, environmentally, or anything else? My patient states that they do not have any allergies. So again, I'm going to verify with my MAR that I have the correct medication, and the doctor has ordered heparin 1,000 units, and what I have here is 10,000 units in 10 milliliters. So I'm going to have to do a conversion, and I figure out that that is 1 milliliter of heparin to be injected subcutaneously. So I'm going to perform my hand hygiene. I'm going to get my gloves on here. I'm going to let my patient know that this medication is given as a blood thinner to reduce blood clotting in the blood vessels. I'm going to go over some side effects. You may feel a slight stinging or burning at the injection site. That is totally common with all injections. I'm going to go over the common side effects, which would be easily bruising, or if you have a scrape, you might bleed a little bit more easily. Some adverse effects would be blood in the vomit or black tarry stools. If you experience any of these symptoms, please let me know immediately. And my patient's given me consent, and I have double checked with the MAR, and we are ready to go. So the first thing I'm going to do is I'm going to uncap my medication. I'm going to verify with the EHR and the MAR. I'm going to get my alcohol swab here, and I'm going to clean the top of my vial and allow that to air dry. As I'm doing that, I'm going to grab my syringe, my 25 gauge syringe with a 5/8 needle. I'm going to pull that out of the package. I'm going to, without uncapping the needle, withdraw 1 milliliter of air. And I'm going to uncap my needle, and I'm going to inject this directly into my vial. I'm going to slowly inject the air into my vial. I'm going to carefully invert, and I'm going to begin to slowly withdraw to 1 milliliter of heparin. And I'm going to be careful not to have any air bubbles. I can go a little bit above the 1 milliliter and just tap my needle and make sure that I have no air bubbles. And I do not have any air bubbles in my syringe, so I'm going to pull my needle out. And using the 1 scoop method, I'm going to cap my needle and make sure that that is ready to go. So before we do our injection, I need to find my injection site. And a subcutaneous injection can be done on the upper thigh, the lower abdomen, or the back of the arm. Today, I'm doing the lower abdomen. So I'm going to inspect my site, see if what the skin integrity looks like. Everything looks good. There's no bruising or rash or open wounds, nothing to be concerned about. I'm going to slightly palpate the skin and make sure that I don't feel anything that would be notifying me that this site would not be a good site. And everything seems great. I'm going to take my alcohol swab and I'm going to clean the site in a circular motion, going about 2 inches around. Before I did that, I was able to pinch the skin and I measured with my needle that I had about 1 inch around. That was a good site. So that is something that I forgot to do, but I'm adding that in there. And I don't want to compromise the sterilization of my patient's skin. So that is good. So I'm going to let that air dry. We do not want to wave our hands on it or blow on it. It needs to air dry on its own. I'm going to take my syringe and I'm going to hold it like a dart with my dominant hand. This injection is going to go in at a 45 to 90 degree angle while I'm pinching the skin, and it needs to be administered in a 30-second time period. So my patient is air dried. I'm going to uncap my needle. I'm going to pinch my skin and I'm going to stick that in just like so and slowly inject the heparin into my patient. Okay, I'm going to pull my needle out, dump that into the sharps container, and I'm going to lightly hold gauze, making sure that I'm not putting too much pressure or massaging the area. If the bleeding continues, then I can let that air dry or possibly leave the gauze on for a little bit longer. So everything looks good. I'm going to continue to monitor my patient for any of the side effects that I mentioned earlier. At this point, I'm going to thank my patient for their time, ask them if they have any questions for me. They said they're good, and I let them know that if they need anything, I'm right around the corner, so they can just call me and I will come in. So I'm going to lower my bed to the lowest position, make sure that my patient has their call light. I'm going to remove my gloves and clean up my area here. I'm going, if this medication was not administered at bedside, I can label my medication with the name and the date and the time on the medication label. I'm going to perform my hand hygiene and get ready to document. I'm again going to document the patient, the medication, the dose, the time, the route, and the injection site while I'm documenting that we did that in the lower abdomen. So yeah, that includes everything that I think I need to do. So have a nice day.